Hello guys and welcome back to our channel. Now for far too long, the harsh realities of the American healthcare system have been dismissed, downplayed or ignored. But today we are witnessing something remarkable. Palm-color people, often insulated from the worst of these systemic failures, are finally waking up to the brutal truth. Now as they share their own experiences with the American healthcare system, they're discovering what Black people have been saying for decades, that this system is really broken, that it's designed to prioritize profits over people, and that it's leaving countless individuals to suffer and even get unalived. From the struggle to set up appointments with doctors to the outrageous costs of medical care, these individuals are confronting the grim realities of a system that's supposed to heal but often harms instead. Now, one of the most striking takeaways from these testimonials is the call for accountability. As one individual says, if an insurance company denies your claim for a life-saving treatment, they should be forced to refund your premiums. If they can't save your life, then they shouldn't get to keep your money. Now, this is more than just a rallying cry. It's a demand for justice. It is a recognition that the American healthcare system is not only morally bankrupt, but also economically unsustainable. So with that said, let's get into these powerful testimonials and explore the ways in which the American healthcare system is failing its citizens. Take a look at these videos. I will be right back.
God, healthcare and dental care in this country are so I go to get my root canal on a tooth that I have not had work on because I paid the other day to see a dentist and they told me that I needed a root canal done on this tooth. Well, I go to another dentist to get the root canal on the tooth. That's not even that tooth that needs the root canal. It's the tooth behind it that I already paid to have work done this year. I already paid almost $1,000 to get work done on this tooth that's still up. So now I need 2 root canals, 2 crowns. At this point, I just hope I go septic and put me out of my misery.
Right now, I think the word is humbled. I don't think it's the correct word of what I'm feeling. When I moved back to Arizona, when I moved back to Arizona in 2018, I was really depressed, and I didn't have a job, and so I applied for Access. Best way to describe it is socialism. It's when the government gives you basically free healthcare. And when I voluntarily checked myself into the hospital, I really kicked into gear. Access paid for my entire stay. I was in the hospital for, I think, 4 days, five nights, 5 days, whatever. I was there for about a week, give or take. I got out. I saw therapists. I got a primary care. I got a job. I got better. I got a better job. And then the pandemic hit, and this Access just rolled over for benefits because we were going through a pandemic. And I just got a notice that it was to reapply. And I knew this day would come because I make $30,000 a year. And I no longer qualify. And if you're not from America, the amount of it that I have to go through now to find insurance, and it's going to be so expensive, and I know that other Americans are going to be like, Taha, sucks for you. But I just got an injection for my migraines that works, and I have medicine that I have to have for my depression, and it works, and I like my primary care doctor. I've had him for 3 years now, and I won't have him anymore because he's going to be out of network, and it's so stupid. I'm going to have to jump through so many hoops, and it's going to cost me so much money, and I'm really scared, and I'm sad, and I live at home, and I want to move out, and I can't see that. I can't afford this. America. And if you want to yell at me for saying Taha, you got away with it for too long, I just enjoyed the last couple of years what it feels like.
She's currently in kidney failure. She's been sick for months, but bedridden for like 2 weeks. She's gotten blood work done twice and her levels are terrible. The first time she got her blood work done, they were supposed to fax her blood work over to a specialist for kidneys, and they said they did. But when a week goes by and the specialist still hasn't called so that we can make an appointment for my mom to get in, my dad calls back and is like, what's going on? You know what they tell him? Our fax machine was down and the fax never went through. My mom has been suffering the whole time. She's sitting here suffering while she's waiting to just make an appointment, not even get into one. Who knows how long it's going to take for her to actually get in. They couldn't even fax over her lab data so that she could get an appointment. That's not even the worst part though. The worst part is that you have to wait for so long to get into a specialist. My mom has to sit here and suffer and remain in kidney failure and wait until she gets in to see a specialist. What? When we're sick, we should be able to get help when we need it. You can literally see my hand shaking. I'm so angry.
There should be a law that if an insurance company denies your claim for a life-saving treatment, that they have to refund every single premium that you paid to them. Because if they can't save your life, then they shouldn't get to keep your money.
I'm pissed. I'm pissed right now. The American healthcare system can eat my whole... I'm gonna cuss a lot in this video. I'm furious right now, alright? I just turned 26, got kicked off my parents' health insurance, which is fine. I guess that's a rule for some reason. I went and was responsible. I went and got health insurance. I paid $230 a month for it. Here's the thing. That's after I cut like half of the that I didn't need. It was originally $500. So it's $230 a month. I go on the portal. I'm looking for a new neurologist. If I don't get my meds, my brain will implode once a week. Okay, that's how it works. So I'm looking for a new neurologist. I find one on the portal. I go to the neurologist, and by the time I'm there, they're like, hey, we don't take your health insurance. I found you on the portal. Are you kidding me? How does that even make sense? That doesn't even make any goddamn sense. What the hell is going on? I swear to God, the American government just wants their citizens to just suffer. This should be free. None of this should be an issue. Why do I have to go to a private company to get health insurance? And then I still pay a copay. I pay $60 to get seen by a doctor. I'm already paying $250 a month. Are you kidding me? That's insane. This should be free. There are first world countries that have already figured this out. Canada, the UK, Japan, Italy, so many other countries on the list. Why are we still dealing with this? It is the dumbest thing in the world. And here's the thing. I think I'm a pretty fine citizen. You know what I mean? I work. I have a full-time job. I vote. I eat ass. I do everything right. And then you just go over here and you're like, nah, man, you got to pay $250 to not get any coverage whatsoever. What the hell is going on? Ugh. Anyways, I work at a sandwich shop. Today, I'm not making any sandwiches with love. I'm making them with rage.
If you're ever wondering how bad healthcare is in America for someone who doesn't have a job that provides them benefits, it is bad. Because you want to know what I've been doing all morning? I've been trying to find a doctor so that I can go, I don't know, get a checkup because I haven't been checked in, 2 years. And when I called UCLA Health, I was like, hey, I want to schedule an appointment and I see that you take my insurance. And they were like, well, unfortunately, you're not assigned to us, so we can't accept you. So in order for me to then get scheduled by them, I have to go call my insurance and get assigned to their health group, whatever that means. So I do that. I call my insurance. I'm like, I would like to go to UCLA Health because I've heard great things about them. People love going to them and I just want to be assigned to them so I can go to the doctor so I can make sure that I'm not... My insurance is like, well, unfortunately, we don't have a contract with them anymore. They don't accept our insurance anymore. And I'm like, what am I paying for? So I'm like, okay, can you send me a list of people that do accept our insurance and can we figure out who I can go to make sure that, my organs are functioning properly? They give me a list. I call a bunch of doctors. Half of the numbers don't work. Half of the numbers don't answer anybody. And when I finally get someone, they're like, okay, now we have to reassign you and you need to call your insurance back. I call my insurance back. I love the person I was working with. They've helped me all day. We reassign me. I call back the doctor. Guess what happens? This doctor is like, who were you talking to earlier? I'm like, one of your coworkers, I guess. They hang up on me. They send me to a survey to ask me how well they treated me, and I put unsatisfied for everything and after an entire morning of calling multiple people, I still don't have a doctor's appointment. On top of that, whenever I tell people what insurance I have, they're always like, ooh, I pay so much money for you to tell me that I have bad insurance, that my insurance makes you wince? Are you kidding me? I need to get out of this country. I need to leave. I need to flee before something bad happens to me and I can't go to a doctor without paying an arm and a leg, even though I already pay monthly insurance fees.
On the topic of how up American healthcare is, we have a new problem. Well, I have a new problem. So I've been using these free therapy sessions through work. We had 10 a year. Next year we get 12 a year. So I'm coming up to almost my 10th one at the end of this year. And if I do every week until the new year, I will end up going to 11. So I'd have to pay out of pocket. So I was like, no big deal. I have a health savings account. It doesn't have a ton left in it, but we can use that. Not a big deal. Except no, you can't. Because you cannot use your HSA, your health savings account, for paying for therapy unless you have a billable mental health medical condition. The only way you can do that is by going to a psychiatrist. And so I'm Googling this, and the first thing I see says, this is difficult because most psychiatrists do not take insurance. Huh? And it says, good news though, you can use your HSA to pay for that psychiatrist appointment, to get some kind of diagnosis so that you can use your HSA in future to pay for therapy. Except I only have about $600 left in my HSA because I've had to go through all kinds of medical, mental health, and other testing, diagnoses, etc. And most specialist visits of people I've been going to see are around $500 or $600. So I have to spend my entire HSA health savings account on seeing a psychiatrist to get a diagnosis to use money that will no longer be there to pay for therapy. What? But it gets better because you can use an HSA to purchase sunscreen. What? So I don't have to worry about sunburn, but if I have a mental health disorder that's not recently diagnosed or they don't have a record of it on my current insurance, I have to pay out of my regular bank account for that. What's wrong with this country?
As long as I'm talking about all the layers of completeness with the American healthcare system, especially getting health insurance through your employer, ignore the poodle in the background. Did you get that out of your system, Athena? Okay, where was I? As long as we're talking about how terrible health insurance is in America and how most of us get it through our employers, and that's just a terrible plan. It is a benefit, added on to entice us initially to come work for somebody. This person said that they have to buy their health insurance, or if they were to buy their health insurance, it would be $1,500 a month premiums for their family with a $15,000 deductible. And that $1,500 a month is, more than twice their mortgage payment. And this person replied, well, that's an amazing mortgage. And they said, yeah, but we bought our house like 25 years ago in Kansas City, Missouri. To which my immediate thought was $1,500 a month. That is more than twice my mortgage payment every month. Now I know that we bought our house in 2008. I have a dumpy rundown land trust house. It's small. It's not part of Portland. But I was thinking about how much we pay for our healthcare premiums in relation to our mortgage payment. Now, my husband is a teacher. We have really good health insurance with Kaiser, which is a nonprofit health plan that a lot of folks on the West Coast have, or they have them for their health insurance company. The plans vary greatly depending on what your employer has negotiated. So, teachers across the state have different plans. Anyway, so we have a good plan, but there is our monthly premium, which comes out of our my husband's paycheck. But then there is also the employer contribution, right? And I think that often gets forgotten. The employer contribution, that is part of your compensation package. That is part of your pay that you get compensated for your work, right? It's just that it is not given to you in your paycheck. It's immediately applied toward your health insurance premium. So it'll go something like, oh, well, your employer is going to contribute $1,100 a month toward your family's, dental, vision, and medical plan. And then you have however much you have to pay for $500-$700 a month. So I think it's really important when we are assessing the cost of our healthcare, even if we are covered, even if we have good health insurance, realize all of that money that your employer is contributing to your health plan is money that would otherwise be in your paycheck if we had universal healthcare. That is part of your compensation. And I think when folks, presume that we could not afford universal health care if we got taxed more in order to fund it, they forget that a significant portion of it would be funded by the taxes from the super rich, which is why we are in a plutocracy, because the super rich don't want to pay their fair share of taxes. They don't want to make sure that we have a just and sustainable society with a high quality of life for the working class. They just want to squeeze us for everything that they can and continue to enrich themselves. Okay, before I go off further on that, my point is that if we had universal health care and all of that money, $1,100 a month or $500 a month, however much your employer was contributing toward your health insurance, was no longer required because you had universal health care, Medicare for all, that would be more money in your paycheck. That would be more money that you could decide what you do with it. And if a percentage of that did end up going to increase taxes for Medicare for all, well, cool, you are still coming out net ahead. So just remember not only those hidden costs, but those ways that you are deprived compensation for your labor and expertise. Yeah, just remember that these are all of the different layers of ways that the for-profit healthcare system keeps you poor, makes you struggle harder.
The American healthcare system is frightful. Universal healthcare would be delightful. But since we've no place to go... HCAO, HCAO, HCAO.
Private insurance shows no signs of stopping.
Your premiums will not be dropping.
If you're they keep saying no.
HCAO, HCAO, HCAO.
Healthcare's now a constitutional right. It's time to push now for deeper reform. And we need you to join this fight to make affordable healthcare the norm.
The governance board is working.
A responsibility they are not shirking.
Is your legislator ready to go? HCAO, HCAO, HCAO.
Oregon flies with her own wings.
We've made it through harder things.
This is the only way to go.
HCAO, HCAO, HCAO.
HCAO, HCAO.
HCAO, HCAO.
HCAO, HCAO. HCAO, HCAO, HCAO.
Now, there are several issues with the American healthcare system that contribute to the systemic inequalities. The first is the exorbitant costs of healthcare. KFF reported that health spending in the US was projected to total $4.9 trillion by 2024. Now, KFF polling data from 2024 revealed that nearly half of US adults said that they had difficulty affording healthcare costs, with medical bills remaining a top financial worry for adults and their families. Now, according to their data, 1 in 4 adults put off needed healthcare because of the cost, and 1 in 5 adults haven't filled a prescription because of the cost. Black and Hispanic adults, women, parents, lower income, and uninsured adults experience a disproportionate amount of healthcare debt, KFF data revealed. Now, structural inequalities within society play an instrumental role in health outcomes. Research indicates that structural racism, redlining, environmental injustice, bias in medical care, food insecurity, maternal health rates, name it, heavily contributes to health inequities. For years, Black people have been sounding the alarm about medical deserts, the lack of necessary healthcare access that those living in rural communities face. 2021 research published in the Journal of the American Medical Association revealed that there were racial and ethnic differences in measures of health status, access, and affordability, with poor Black individuals reporting worse health compared to their counterparts. Now, since former President Barack Obama signed the Affordable Care Act into law in 2010, the number of uninsured individuals has decreased significantly. Individuals with health insurance are more likely to utilize preventative services that could lead to better health outcomes, research reveals. Now, data from the U.S. Department of Health and Human Services indicated that there were significant declines in the uninsured rate of non-PAM color populations between 2010 and 2022, signifying that the ACA led to historic gains in healthcare coverage. Now, despite these gains, the United States doesn't provide universal healthcare coverage to its citizens like Canada, Denmark, France, Germany, Norway, the United Kingdom, and other countries in the global north. Employer-sponsored health insurance is the golden handicrafts that keep many people hostage. eHealth Insurance reported that as of 2022, 78% of the US population was eligible for health insurance through their employer. Now, those who change or lose their job, part-time and gig-based workers, and seasonal employees are more likely to have gaps in their insurance coverage. It's clear how broken America's healthcare system is. How can the system be reimagined for greater accessibility and equity? First, it's important to fight against the repealing of the ACA. While Trump's stance on the ACA has been conflicting, it's likely that under a second Trump presidency, the ACA subsidies implemented under the Biden administration will be eliminated, which will result in increases in premium payments. Now, the data is clear. Expanding healthcare access through health insurance is linked to more positive health outcomes. Gaps in healthcare coverage results in poorer health outcomes. So there must be efforts made to ensure Americans are covered and that they do not have to pay astronomical costs for their monthly premiums. Now, expanding Medicaid coverage can also improve healthcare outcomes for Americans. Cost continues to be a major barrier to healthcare coverage in the United States. According to American Medical Association, gains in health insurance coverage were the result of the implementation of enhanced subsidies for ACA exchange marketplace plans. Now, the continuous enrollment provision of Medicaid, several recent state Medicaid expansions, and improvements in enrollment outreach. Now, another way to transform America's failing healthcare system is to address the high rate of insurance claim denials. Many have taken to social media to discuss their experiences with America's healthcare system and how an insurance claim denial impacted them or their family member. Now, many health insurance companies, including United Health and Humana, have been sued for using faulty artificial intelligence models to wrongfully deny health insurance claims without a physician's review or against a doctor's medical judgment. Now, according to a ProPublica report, insurer denial rates are shrouded in mystery and there is lack of transparency regarding why an insurance company rejects recommended care. Transforming the broken system should include requiring regulators to require insurers to review how often they deny claims and provide more specificity as to why. Now, the American healthcare system's failures are finally getting the attention they deserve. But it's striking to note that this reckoning has come at a peculiar time. For years, Black people have been vocal about the systemic injustices and disparities that plague the healthcare system. They've shared their stories, their struggles, and their frustrations, only to be met with skepticism, dismissal, or outright silence. But now, as the healthcare system's flaws begin to affect a broader swath of the population, palm-color people are suddenly taking notice. They're experiencing the same frustrations, the same injustices, and the same fears that Black people have been living with for generations. And as they share their own stories and struggles, they're finally beginning to realize the truth of what Black people have been saying all along. It's a peculiar phenomenon. This delayed awakening, it's as if the struggles of Black people were invisible, irrelevant, or somehow less legitimate until they began to affect others. But the truth is, the American healthcare system has always been broken, and Black people have always been the canary in the coal mine, warning of the dangers that lurk within. The irony is that palm-color people are now experiencing the same sense of outrage, the same feelings of helplessness, and the same fears for their future that Black people have been living with for so long. And as they begin to demand change, to call for reform, and to advocate for a better healthcare system, they are finally beginning to understand the struggles that Black people have been facing for generations. It's a hard-won recognition, but it's a necessary one, because until people acknowledge the systemic injustices that have been perpetuated against Black people, until they recognize the ways in which the healthcare system has failed them, and until they begin to make amends for those failures, they will never truly be able to fix the system. But now that it's affecting everyone, just maybe something might be done about it. We have finally come to the end of the video, but share your thoughts, your contributions in the comment section. Thank you for always watching, and see you in our next video as we bring you another interesting video.